Hi, my name is Anna. If you're preparing for your Step 2 CS exam, I'd like to show you how Amboss can help. The Step 2 CS test involves an examinee and a patient. Angela will take the test in a few weeks, and Afonso is helping her get ready. Together, they'll walk us through a case. Friends acting as practice patients can find explanations in layman's terms, so they can support your studying without a medical background. Each case is unique, with different patient instructions and dynamic real-life challenges. Amboss CS cases create scenarios that will help you be ready for the cases on your exam. So while Afonso is getting ready, Angela is reviewing the doorway information and preparing her blue sheet. In Amboss CS, you'll find an opening scenario, vitals, and examinee tasks, designed to get you thinking about differentials. Okay, it's time to start the clock. Enter the room and introduce yourself to the patient.
Hi. Hi. I'm Dr. Williams.
Hi,
nice to meet you. So, what brings you here?
Well, I started having a little difficulty swallowing.
Ask the patient some questions related to the case.
So, do you have any allergies?
No, not that I know of.
An Amboss checklist is there to help. Using mnemonics can help aid in memory and patient vitals, which can be found in some of the cases within Amboss.
Have you ever been hospitalized?
No.
Next, Angela will examine Afonso. Don't forget to wash your hands. And stay calm. You have everything you need at your fingertips. Each Amboss case is realistic and includes a detailed physical examination checklist, so examinees will feel comfortable and confident while performing the exam.
So, Afonso,
After the examination, you'll have a closure and counseling talk with the patient. Your communication and interpersonal skills are just as important as the clinical encounter. Use the patient's correct name, show empathy, and look the person in the eye. Each case lets you practice and assess these skills.
Thank you.
welcome.
During the CS exam, you'll have 10 minutes to write up your patient notes. That means you must work fast. Amboss replicates what you will see on exam day, so you'll be ready. Compare your patient notes with the samples written by Amboss physicians. Within each case, you can review DDX tables, watch physical examination videos, or hover over speech bubbles for a more in-depth overview. The Amboss CS package is the only resource you need to pass your exam. Man, I can't get anything right.
Nephritic syndrome?
Yep.
I'm struggling too.
What should we do?
I need to work on my nephrology.
Yeah, me too. With Amboss, there's no need to continue juggling multiple resources. Every question within the Amboss Qbank directly corresponds with an integrated learning card, giving you the option to dive deeper into any medically related topic. Everything you need is now available, in one place.
Are you excited to try the practice questions in Amboss, but you can't figure out how to start?
We get it. There's lots of different ways to achieve your study objective and tons of material in Amboss for your next exam.
We can show you how powerful the Amboss Qbank can be by guiding you through the different parts of exam preparation and custom question blocks.
Join us, Remy,
And Abigail,
on June 3rd at 12 p.m. Eastern Time for a comprehensive tour of our Qbank and learn how to save time and score high on your next medical exam.
Hi, everybody. Welcome to our next webinar that we are hosting for you all. Today's topic is using Amboss on the wards. I'm Olivia. I have been working with Amboss for a little more than a year since we launched in the US with our English version of our platform. I came to Amboss after working in a molecular medicine research lab and found out about this cool new product coming in to try and revolutionize the medical education platforms and tools that we use, and have been really excited to be a part of this whole movement as we've been moving forward in the past year. And I'm here with Tio.
Hi, everyone. Again, thank you for joining us. I'm Tio. I'm an outgoing fourth-year medical student at Harvard Medical School. I'm headed on to UCSF for radiation oncology. And I've been working with Amboss for about 1.5 years now. First working really with the editorial team to design some of the Step 2 and shelf questions, and now focusing a little bit more on Step 1 preparation. So we're super excited to tell you a little bit more about Amboss, not just from how to prepare for your shelf exams, but how you can use them to be very successful on the wards.
Yeah, and I'm actually really excited that we get a chance to talk about this, because this Amboss as a clinical companion is, I think, one of the unique benefits that a lot of the ambassadors and other students who we've met in the past year have said that they've been able to bring it in as a tool in kind of their repertoire. But so you're just finishing up your 4th year, and you've already matched, and so you've finished this clinical experience side of your training.
Yeah.
How do you feel now being done? Like, do you have kind of a different opinion going out as coming in? How was your first clerkship compared to your last clerkship?
Yeah, so clinical medicine is just a wonderful place to be, but it doesn't feel like that every day. You go through the process of medical school, really doing coursework, and then suddenly you get thrown into this clinical environment, and you begin by being completely disoriented. You're joining this new team, everyone's more experienced than you are. You don't even know what some of the medical lingo is, even though you've been studying really hard for a long time. And so a lot of the first part of your clinical rotations is just get a sense of what things are, where things are, where the bathrooms are, who you ask for help, what you're supposed to be doing on a day-to-day basis, and where you go from there. By the time you get to the end of your clerkships, you'll be exhausted because you've worked a lot, but you'll also be very excited because you've learned a lot. You're better able to take care of patients. You're no longer worried about these logistical things, and you're actually able to lead the team on the patients that you have. And so there's this huge learning curve that you go through, and so much growth that you have from the very beginning all the way to the end.
I think that's a really nice kind of way of describing that arc. And I think one of the things that I receive when I hear students talk about their experience is their clinical year, their clerkship year is really the first time they're kind of getting to be a doctor, right? Like they're getting to do the stuff that they've been prepping probably for, at least if you've gone through the traditional path in the US, this whole bachelor's experience, and you've got your 2 years of med school. And so did you feel like the clerkship year was your kind of first or best time to really explore the patient-physician relationship and that sort of care aspect?
Yeah. So the clerkship year is just a very different year from the rest of the years. It feels like every time you're in med school, every year is just a totally different task that you're doing. So before, you're always leading up to it, right? You're always, I'm going to get there. I'm going to get to this point where I'm actually doctoring and actually seeing patients and actually understanding what they need. And before then, you focus all of your energy on asking yourself, what does it mean to be healthy? What does it mean to be normal? What does your body actually look like when it runs? And then you spend a part of it thinking about what does it mean to be unhealthy and what makes someone unhealthy and trying to understand how you diagnose something.
Yeah.
And then you get into the clinic and then you're like, oh, I don't need to just be able to diagnose something. I need to be able to treat this person that's in front of me. And so your clinical year becomes this year of thinking about not just how do I understand the pathophysiology of disease or what someone should look like if they're healthy, but how do I understand this person in front of me, what they're dealing with, not just as a larger disease, but this individual, and how do I treat them in a way that really makes sense? And that year you really get to own that, but in that process, you have to learn what you're going to do because you haven't learned it before.
Right, and you have to build up this library of kind of patient profiles so that when you are doing these questions and eventually when you start practicing, you have this sort of these background caricatures almost in your head of who can represent a disease, what did it look like, what are the odd cases, and this experience is really one of the best times to start to explore that in person. So I just want to read a message that someone sent to us. She's a new family medicine resident, and she was sharing her experience of working, being as a resident first time in the wards, as the owner of the project, basically. So to quote her, says, I needed to find a way to study in the hospital without lugging around books, so a friend suggested Amboss. Up to date is great when you have time to read through an article or you need in-depth information for complex management decisions, but during crunch time, when I require fast answers on the basics, Amboss has become my go-to. Several times now I've rapidly reviewed disease processes on Amboss before rounds and successfully survived being pimped by my attending. So I want to kind of ask you basically, what what was your first clerkship like? Like, how did you start when you walked in your first day, and how did you start to gain some composure and resources to start to be successful in that first time?
The first clerkship is a challenge. You walk in and you're really not sure where you are, and like I said before, it's very disorienting. There's a team that you're going to be a part of, and you don't know anyone on the team. There is this new clinical context that you haven't been in before, and then there are all these patients that are on the list, and you're not really sure how you're going to manage them or what you're going to contribute to that process. And when I think back to my first time, I remember one of the things that was really difficult is, there are different times that patients are coming in and out, and more or less you get assigned maybe one or two because you're very early in your training, and it's really your job to learn everything there is to know about them. To really know like what their history has been, know what they're coming in for this time and what's going on. And usually patients don't come in the way that you would often think about as in just like one disease process. You usually have a lot of things that are going on. And so you have to really think about, how am I going to learn the most about this person and contextualize them? And what kind of resources am I going to use to make sure that I can like contextualize this patient well? So a lot of times you're just trying to figure out, how do I contribute to a team where everyone knows more than I do, and how do I actually master the patient that's in front of me?
And what external resources did you use to do that? Because I know your team also was pretty supportive, right, in giving you information. But like, what did you do outside of the class, not the classroom, but outside of the wards to prep for becoming an expert on these patients you were assigned?
And so that's your first thing. That's the most important part, is you should realize that you should be the expert on your patient. So you're really just being an expert on the 1 to 2. You don't have to do any extra patients. They just really want to make sure you know them. And what you can do is really use them as a jumping off point to look at resources. I think one of the things that's really cool about the library that we have with Amboss is that it has a really nice outline from really just the clinical presentation to actual how you would do diagnosis and treatment, all the questions that you know you're going to actually experience on the wards. And so it's a nice place to start, because what you can do is you can get a sense of what the disease process is, understand it from a very high level, and then dive into the deeper granularity details that we have there. But we format it in a way that like makes it very easy to digest. It's sort of like a Wikipedia page. And then from there, you can go on to look deeper once you actually understand the basics of what your patients are dealing with.
Yeah, totally. So I'm just going to show you guys quickly how we set up our library. We've got on the left-hand side a breakdown of clinical knowledge area, a clinical skills section, a user guide, which is some cards to show you how to use Amboss within the platform, and also our Chalk Talk area, which includes some lecture-style seminars. And as Tio said, when we create our library content, we break down our topic areas, our clinical knowledge areas, according to the USMLE content outline, and make sure that each of the kind of key topics around these particular areas are featured in a learning card. So we also have, just to briefly show you, just so that we're kind of all on the same page, we also have a Qbank, which some of you may have used before, and an analytics tool. And you can access all three of these on the left-hand side. So maybe we can just imagine your medicine rotation, and you have 2 patients who have been assigned to you. Can we sort of explore how, after you've received these 2 patients, how you might use a library like this to give you some background information? And
So often in the medicine rotation, a patient will come to you from the emergency room, and you'll be thinking about what you're going to do with this patient. You're about to go down and see them and understand like what's happening, what questions I should probably ask them. And so one patient that I got on one of the early days of my medicine rotation was just a patient who was coming in with pneumonia. And I didn't really know much more about them than the fact that they were coming in with probably a pneumonia. The work hadn't been completely done for them yet to actually diagnose the pneumonia, but we knew that they were pretty sick, and we needed to think about what additional work we need to do in the meantime while they were still in the emergency room before they got to us. So I had a few minutes after I heard about this patient to think about what were the things I want to tell my team that I wanted to actually order for this patient in order to properly diagnose them and then effectively treat them.
So you probably had a couple symptoms, right? Did you have what kind of lab reports, what did you have and where would you go next to kind of figure out what you actually need?
So when you get a report from the ED, you get a sense of like what the patient's coming in with. Now this patient looks pretty sick, so they know they're gonna probably admit this patient, but you just get a report that says this patient comes in, they have a bit of a fever, they have shortness of breath, they've had this progression of their symptoms over a couple of days, and they're not really sure what's going on, but it's suspected pneumonia.
Mm-hmm.
They're thinking about tests that they want to order, and you have to go through and figure out what additional things you want before they get to you. One of the things that's really nice here is that if you look through Amboss, you can actually go through and think about the different features of a disease process, and it's at various stages. So if you think about the basic science aspect of it, there's this pathophysiology section that really lets you explore like what actually is going on and really helps you to understand the pathology so that, when you have to answer those questions to your attendings, you'll be really well aware. It's also really helpful because when you are thinking about how to manage a patient who's very complicated, sometimes coming back and reviewing this pathophysiology will give you a sense of what actually is the most effective therapy when it's not really clear and not really black and white. But in this case, when we're thinking about, we have a patient in the ED and what do we want to do, you want to think about what kind of pneumonia you think this is. So this is where the clinical feature section of Amboss comes in. It's nice because it lays out a variety of symptoms that you'll have, and you notice there's some that are bolded that give you basically a sense of which ones are really important ones that we kind of see more often and give you real good diagnostic information that allows you to tease this apart from other things from a patient. And it's categorized here in terms of typical pneumonias and atypical pneumonias, which gives you a sense of really like what your patient is dealing with and how you're trying to triage them. But as we go further down, what we really want to look at is the section that is on diagnostics, because this is the question that you are going to think about. So what are all the things that you want to actually order for your patient so you can better assess what's going on with them? And so this is the nice thing about the way that Amboss is laid out, is that it gives you the information and allows you to do a variety of stages of your thinking. It allows you to think about the clinical presentation. It allows you to then think about the diagnostics of how you're going to actually better assess what the clinical presentation is. And in a second, we'll talk a little bit about management.
Okay, perfect. I'm just going to briefly look over at some of your questions that you guys have. So we have a question that says, do you use the app when you are on the wards before presenting to your attending, or do you learn about that patient later when you're home? And my gut is that it's a mix of both, right? But how would you answer that, I guess? So
I think it's a mix of both. So in the scenario we're talking about right now is usually you'll get a chance to actually think a lot about the patient before you present to your attending. Really, you'll get a readout from your patient, from the resident and the intern. And you'll have a chance to actually read all about them and really go through and probably assess them yourself. So I would actually, before you actually even go and interview your patient, while you're in the hallway, take a quick moment and look through the Amboss cards on your phone. The reason why is that if you look through the diagnostic information, you can ask yourself, what are the symptoms that I need to ask about? The clinical features, diagnostic information, what are the symptoms I need to ask about so that I can tease apart what's actually important on my differential? So if you start off with that, you have a sense of going in and having a rational reason for why you're asking about shortness of breath.
Right.
And then by the time you get to getting the story and presenting it to your patient, to your attending, you're going to look really good because it's going to be clear why you asked those questions and also what order to ask them in. So that's where you use it on the wards, is to get some information on.
I'd like to highlight what you just said, because I think that's really key. The why you asked the question, and you said something else. So the why you asked the question and how you know you're going forward.
Yeah.
So I think that background thinking is usually what people are looking for. They don't necessarily want you to just regurgitate, right? They can look it up as well, right? They want to be able to see how you've come to that conclusion, and do you know all the back steps ahead of time, which is the hardest thing, I think, to learn, because the question is directly a fact or an ask,
Right.
And you were just going to start about outside of the space, and I wanted to show some of these images, but I'll let you start, and then I'll pull up some of the imaging and kind of show it from there.
Just to answer the other side of your question is, I think it's good to use this ahead of time when you're actually just about to go see your patient, just before that. And then if you're at home, what you can do is you can use it to consolidate. So things that you learn during the day, things that you still have questions about for your patient, you can continue to look at you can look through Amboss a little more in a detailed fashion, and we'll show you some really cool tools that allow you to extend your learning as well.
Yeah, and for example, just because we're here, like when you first start looking at images and at chest x-rays, right, like you are, it's a new language. You're learning how to speak this language, and it's a visual language, and you've spent a lot of time like putting facts in your brain, and like when you open up a chest x-ray for the first time or the third time or the 10th time, like you're still training your clinical eye and figuring out what you're actually looking at. So maybe you received a chest x-ray from this patient. Maybe you haven't gotten it yet, but you'll get it and you'll come look at it later. One of the things that Amboss can help you do when you're outside of the wards and more of a study space is you can look through these particular types of chest x-rays about lobar pneumonia, for example, and test yourself, like, what am I looking at? So maybe on your first day, you can't really see where the density is coming, where you should be looking at, but maybe after a bit you can see, like, maybe there's something on the left-hand side I should be paying attention to. Not really sure exactly what it is, but maybe I have an idea. You can always turn on the overlays at this point to really be able to point out what you should be looking at and where you're going next. And we have another question. So say you get a patient on the wards and you already have a diagnosis. How do you use Amboss to develop an assessment and plan? For example, this internal med style, differential diagnosis, why, and treatment.
So there are a few things with this. So when you get a patient that's coming out to you from the ED, there'll be a diagnosis as a tentative diagnosis. That doesn't mean that's actually the full diagnosis of the patient. So when you are presenting to your attending, they're going to want to know that you've actually fully reviewed that patient, thought through very carefully what the symptom presentations are and what the diagnostics are to make sure that you have a full understanding of that patient, because you are that patient's doctor. So there are a few things that we have if we want to scroll down to actually think a little bit more through this. So one of the things that you want to do is when you look through the diagnostic workup, you're going to be thinking about what each of these tests should be if your hypothesis for what their diagnosis is correct. And so I would think of what you get as the reported diagnosis as a hypothesis.
I like that. That's a good tool, I think, actually.
Yeah. Another thing is that when you go up to these clinical features, you want to think a lot about, is this actually presenting in a way that's typical, or is it presenting in a way that's not the usual way of presentation? And so, like, how much of this are we anchoring on one diagnosis versus really thinking more about others? And so if you look through Amboss in general, we'll give you a sense of the clinical features, and they'll also give you a sense of like what laboratory tests you'll need. And if you notice here, there's this really big outline that tells you that a newly developed pulmonary infiltrate on chest x-ray is the classic symptom for pneumonia, and this is what confirms the diagnosis. So this is one thing you need to know, is that, is this a diagnosis by clinical assessment? Is this a diagnosis by labs? Is this a diagnosis by both? One of the things that's really cool about Amboss is that it allows you to be able to go to your physician, to your attending and say, I know that this is a radiological diagnosis, like we know based on the clinical acceptance, our clinical presentation, that the chances of pneumonia are very high, but we also have a chest x-ray that shows that there's a consolidation in the right, middle, and lower lobe. Without that, you could say, okay, the clinical presentation is consistent with a pneumonia, but I know that this is a diagnosis that we need radiology for, so this person needs a chest x-ray in order to do that. So the nice thing about this is it also tells you what actually do you need to do to clinch that diagnosis and make sure that's what you need.
How often do you need to have answers or parts of your diagnosis from different areas? Like, would you say that every patient you should have clinical and lab and et cetera? Or like, how do you kind of structure that to know like when you're done with a patient to pass them on?
So one of the things that you'll learn a lot during your clinical rotations is it turns out it's really hard to diagnose patients most times because they usually come in with a lot of different things. And so you don't want to wait until you have a diagnosis to actually start managing your patient. And one of the things that's really cool about our platform is that it really gives you some sense of how to do that already. So one thing I wanted to talk about is this treatment section. So one thing that when a patient comes to the hospital, what they want to do is they want to receive some sort of care. And you're working a lot on trying to figure out what actually is going on with them. But if a patient is doing really poorly at the time they come in, you need to start caring for them immediately. So one of the first questions you might be asked is, does this patient need to be admitted? It's possible that you could be on your internal medicine rotation, you could be on your ED route, and you need to know whether or not this patient needs to be admitted. So the way that you will go about this is, notice we have this nice, lovely scale, for example, that's the curve 65, which you probably knew in the back of your mind, but forgot.
Can we show them this on the iPad? Because one of the things I like about this scenario is that you'll get this when you're on the wards, right? Maybe you'll have your phone with you or your iPad with you, and not a computer. So I just want to show you guys how this looks on the iPad, because we do have the library available offline, and that'll allow you to kind of go through. Can we switch over to the perfect? So we can just click on the Knowledge app. We have two apps for Amboss: the Knowledge Library app and the Qbank app, and they talk to each other, and we'll get into that a bit later. So we were talking about curve 65 within the pneumonia learning card. We can just click on the pneumonia card, open it up. You see it's quite similar to how the library looks on the desktop version. But when we click on treatment, we can see, again, the same thing with our breakdown and our flowchart in the upper corner. Yeah, so you were saying you probably knew this curve 65. You just needed a little reminder or a trigger to bring it back up to forebrain area.
And the cool thing about these sort of both these mnemonics and also these scoring systems, you don't need to remember all the parts of them. You just need to remember they exist.
Right. And I think that that's important, to remember in this kind of, especially in the early stages when you get on the wards. And I feel like a lot of people have talked to me about, this almost imposter syndrome feeling of things, right? Like you get there, you got your coat, you're ready to go, and then you're like, oh my God, I have these two patients that I'm responsible for. Yeah. They're looking at me. I don't know what to do next. And kind of figuring out a way to make sure you can support yourself with your confidence, I think is hugely important. And to remember that you've spent so much time putting stuff inside your brain. You just have to find a way to unlock it and kind of get it back together. And so exactly what you're saying, you probably knew it, you just need a reminder. And I think that's one of the best ways that the library can work for you on the wards. So we to pivot ourselves back after
So just a few things I want to show you really quickly. So this tells you a little bit about how you're going to hospitalize the patient or whether or not you need to hospitalize them. And it shows you the level of care as well. Yeah. So whether or not it's just a hospitalization versus an ICU admission. And one thing to note is that these scoring systems give you an idea. They're never 100% the case. If you feel like a patient has a high score but isn't quite there, you can always change it. Mm-hmm. Your attendings want you to be able to make that sort of clinical assessment, but early on, this is a really good thing in your tool belt. Mm-hmm. The other thing is flowcharts. They are wonderful. So if you can take something like this up and actually keep this on hand, this helps you so much in thinking about what you're going to do next. And you can just so quickly say, okay, this is the patient I have. This is what I want to do for them. The next thing that I want to show is that sometimes you'll get into a situation where you see something and you're not really quite sure what it is, and you notice these underlines that exist here. If you click on one of the words with the underlines, you just get a pop-up that gives you a sense of what the actual treatment, for example, this is, and this gives you a definition that you can actually go to. And then you have these boxes that are beside that'll actually give you additional information about the explanations behind usually some of the pathophysiology or why you might want to treat someone a certain way. The last thing I wanted to bring your attention to is what you were talking about before is, okay, so you're doing this, you look this up in the wards, what do you do when you go home? Well, you're probably not going to remember everything you read on Amboss, so you'll probably review some of that, but you might want to dig a little bit deeper. And if you look all the way down at the bottom, you'll see that there are these references that are on each of the different sections. And you can click on a reference, and it will tell you where the information came from. So look, this first one, for example, is an up-to-date article that you can go through and look at. And so once you've gotten this overall picture of where things are, you can then dig deeper and find out more about what's going on, and all from directly in the app.
And I think I'm really glad you showed that. And if we scroll a bit farther down, we can also see the total sources for the card. So if you want to just look at an overall list of how we built the library card and what resources we use to kind of give you these recommendations. And I also and you can use this kind of tool both when you're on the wards and you need this reminder like we were talking about with the curve 65, but if you forget what beta lactam is, or if you maybe antibiotics is a bad example. You forget what an antibiotic is, but you can just mouse over it or click on it and just get this kind of brief definition of what it could be. But sometimes, and this is where you would maybe use this tool, not as much on the wards, but at home, is if you need to go and dive in deeper, we can actually click on these links and open up the next learning card of that topical area. So we just opened up a learning card on an overview of antibiotic therapy. We can go through and dive back in to explore more about that space. And if we want to go back, we can just click on the X in the upper right-hand corner, and it brings us back to the library card that we were at. And this idea of like being able to expand and contract your resources is something that we hold to be very important in our structure of the learning cards and of the questions, because we know that sometimes just like getting too much words in your face like on a screen is just too much. You want to be able to kind of control like by minimizing the amount of stuff that you're seeing. And controlling the amount of input that you're having to filter out. So another tool we use to do that is this high yield mode. You can see here it's this kind of little tab button, and that allows you to condense the learning cards down according to bullet points, images, most important features. And to turn on the highlighting tool, you can also see another way that we can explore how to filter out the kind of any extra information that's not particularly relevant to a question type area of the learning card or the most important things you need to know to diagnose. So we had a question up here that do all the disease learning cards include treatment flowcharts? I would say, so not all of them do, but a lot of them do. And flowcharts are something we're building pretty much all the time. How do you guys talk about flowcharts in the editorial team?
So in the editorial team, and I've worked a bit on the learning cards as well, is not everything has an actual flowchart, but what we've actually done is we've structured the treatment in the order that's actually logical. So the point is that even if it doesn't have a flowchart that's associated, when we go from 1 to 2 to 3, we're really thinking about what are the steps that you need to actually take to treat this patient from the very early on. So some of them will have flowcharts, others will not. Mm-hmm. Something that we think is really interesting that we haven't talked about so far is the ability to consolidate all of your notes into this platform as well.
Yeah. Do we want to show this on a different learning card? Do we have another topical area we can go into? So what was another like case example?
So another one is congestive heart failure.
Yeah, cool. So you have a patient who's come in. Did they have this diagnosis when they came in from the ED, or?
So this is another patient that'll come to the ED, probably presenting with dyspnea and exercise intolerance. So this is something that you'll be thinking about. Just like with your pneumonia, it could be someone who comes in with the exact same symptoms, but instead has heart failure.
Right. And maybe you want to be able to access this card often, like maybe you have a patient or you have a series of patients that are coming in that you feel like you need to keep coming back to a card in general. And this kind of goes into answering one of the questions we had in the chat was we can favorite our learning cards. So you can click favorite here and you'll be able to access that again from the library. So you can see your favorited cards. I've favorited cardiovascular examination and congestive heart failure and Crohn's disease. But you can also see a history of where you've been. I know that Shauna was also asking this, that you can see recently opened cards and you can go through and see what cards you've gone through in the past. So if we just go back, we'll go back to our favorites, to congestive heart failure. And so we wanted to talk about notes, like how we could integrate note-taking within the library based on the patients that you have. Mm-hmm. So how do you think that you might do that as you're going forward?
So one of the things you might think about with a patient who comes in congestive heart failure is that you want to know whether or not they're wet or not, and like what's actually going on that causes them to be so. So if we go into the clinical features of our patient, we have a really good description of where a patient might present. And so you see that the things that we've highlighted are the fact that they have dyspnea, they have orthopnea, they have pulmonary edema, and these are the things that are going on. And this is actually a really great starting point. But when you are in the wards, you're going to learn about a lot of other things that are going on. And one thing that you'll think about is venous congestion, which we cover, but there's more information to be thought about in terms of that. And so you can actually add a note to yourself about the fact that you can have venous congestion in the process of having congestive heart failure. And this is what leads to the additional edema, and this is what leads to you having difficulty sometimes with your kidneys as well. And so you can create this note for yourself as like, oh, not only do I need to remember about the fact that the person isn't like moving blood forward and that's bad because they can't perfuse, it's actually a problem where blood is actually getting backed up as well, which means that things can't be perfused. So if things are not moving forward, and that's not something you really think about until you're like really in the depths of the clinical situation. And so you can really add this note to yourself to, I want to go and look this up later, or I learned this really cool tip or this new paper that has new evidence that's come out that's told me how to treat this.
Right.
And so I put this here.
Yeah. And if you want to send that paper to us so that we can add it, we can send that in as an email to our physician team. You can just be like, oh, by the way, you should check this paper out. That'd be really nice. And send that in, and that sends an email to you guys so you can look at it. I just want to talk a bit about, again, another way to use this kind of mix of on the ward study and outside the ward study, and that's using the Qbank. And we can use the Qbank just in kind of a normal study situation, like at home, at a desktop, on the library. But sometimes you have time on the train on your way to the clinic at 4:30 in the morning. And sometimes you have time in between patients and that sort of thing. So maybe you want to do a couple questions. You're prepping for a shelf that's coming up, et cetera. So we can access the Qbank in a couple different ways. So you can create, and if you want to be able to use the Qbank on your iPad, which is what we're going to show you, you need to kind of set yourself up with a couple different blocks ahead of time so that they're in your overview area. So let's imagine, again, we're still on our internal medicine rotation. We can click on our shelf medicine that we're prepping for. We can open up our first block of nervous system and special senses and click Get Started. And that creates a session for yourself. But maybe you want to kind of explore a bit more. You're earlier in your rotation, you have a bit more time. You want to explore a bit more around this congestive heart failure patient. And maybe that means you want to create a block of questions that are just featuring the symptoms that you have seen. And you want to be able to say, like, when is it CHF? And when is it something else? How can I start to build up my skills in making my differential? And so you had mentioned, like, dyspnea was one of the things for congestive heart failure, but what are some other things that are often like either symptoms or comorbidities that we might want to build into a question session so that we can get a diverse set of questions?
So you want to think about dyspnea. Other symptoms people often come and think about is chest pain or fatigue. These are the common things that patients will actually come in and tell you a little bit about that they're actually experiencing.
Cool. So we can then create a block of questions. We've got 618, for example, here that are associated with these three symptoms. Maybe we want to make sure that we are still focused on internal med. So we want to open up our shelf medicine questions. And this filters it down to just include the questions that are part of our medicine block. And then we can create a custom session. Maybe you want to say, like, remember, like, CHF series or something like that. And you can click Get Started on that as well. And this allows us to go through and then start to access the Qbank from our iPad when we're on the wards. And I'm just going to switch back over to the iPad. And if we click out of this pneumonia learning card.
So if we want to leave the pneumonia learning card, we can go in and go to our CHF learning card. And as you can see, I just typed in CHF as the actual abbreviation, and it was able to bring us directly to congestive heart failure.
Right.
And then now what we can do is we can
open up one of these sessions. So this is where we were at in the desktop. And then if we go over to our Knowledge Qbank, which is the other app, we can open up that Qbank again, then side by side with the library. And if you guys have an iPad Pro, this allows you to be able to kind of keep your library and your Qbank in conjunction with each other. So we can see here that we have a couple questions from our antibiotic therapy learning card at the top, but we also have available this CHF custom session that we were looking at. So we can click that and open it. And this will, if we click again at the top.
So the first time it just downloads it onto your iPad so you can use it if you were offline, for example.
Exactly.
And then now?
And now we have our first question in our block of 40. So we've got our kind of typical USMLE style question stem, longer stem. Most of our questions that are shelf in step 2 are two-step questions, and will allow you to really build out a knowledge around the case and around the stem, so you can start to practice a lot of the different things you need to move through as you're starting to prepare. So let's just kind of very briefly show how, like, when we go through this, we can then open up and create an interaction with note-taking in the library. So if we want to, we can start to pin out some of the things in the stem that are important. So maybe we go through, we've got this 65-year-old man, so we've got his age. He's been encouraged to bring someone along to his appointment. Maybe that's not important, maybe it is. Let's pull out some of the other kind of key information.
So acute lymphoblastic leukemia is one.
Mm-hmm.
They had to do a bone marrow aspirate, which is an in-office procedure, but is something that is painful and can be somewhat invasive. And then the basic gist of this patient of this question is that this patient is about to receive some sort of information or get some sort of important conversation that you want to have with a loved one, and you're trying to figure out, like, what's the most effective way of actually doing this question, because they may or may not have a cancer diagnosis.
Mm-hmm.
And so what we've done is really think about what the key components are and then what kind of question this is, and then we're going to go towards thinking about, like, how we might answer it.
And this style question is probably a bit more CS style, like it's a more patient interactive thing, but we can still select an answer that we think might be appropriate.
So we selected an incorrect answer to show what happens when you do that. So when you select an incorrect answer, there are a few things that happen. One, it glows in this basically like light red orange color that tells you that the answer is incorrect and gives you an explanation for why it's incorrect, very specifically to this patient case. So it's not just a general explanation. It actually thinks about what, in this case, makes it wrong. The other thing is that there's a tip that's given to you, and you can see this in the blue section on the iPad and see that. Remember that there's this very specific way that we've ordered our thinking about how to deliver bad news to patients. The last thing about it is that it gives you highlights back into the question stem. And so you notice it's gone back to what we've looked at. So it's acute lymphoblastic leukemia. So we know there's some sort of serious cancer diagnosis. And then you're setting aside time to, like, actually have this important meeting with the patient. So it tells you it's wrong, but doesn't tell you what the right answer is right away.
Right.
It gives you all the information for you to go ahead and make your next best guess.
So do you want to make a guess?
Yeah. So the next answer, so then what we can do is we can actually go in and select the right answer, and you'll see that it tells you exactly why this is the appropriate answer for this particular patient. And the important thing is that it told you about spikes in the hint. You had a chance to see if you could remember what spikes was, and then we actually tell it to you. And so it's this process of what's called just-in-time learning, where you have the ability to actually be asked a question, to get some sort of, to then get some prompting on what the information is, and then be rescued if something is, not going right, or just get some confirmation if you do actually have something right. And so you're always sort of like constantly like being quizzed and learning at the same time.
Right. And you can also then go through and mouse over the spikes protocol, get a little bit more information. You can get some bonus commentary if you want something that's a little bit more clinical. And then you can, again, in the bottom part, you can open up this library card on palliative medicine, which will then open it up side by side in the learning app. So we could, and so you see now side by side, we've got this palliative medicine card that's open, and the green highlights are the parts that are specific to this question. So the thing about all of our explanations and our learning cards and being able to open up this stuff side by side is we want you to be able to learn about this question. That, for example, if the answer was x-rays, you're not going to get a stock answer about x-rays. It's like, why is x-ray specifically about this particular stem? So Connor asked a couple questions here. He said, I've noticed when I'm doing the shelf questions, a lot of them are repeats from other shelves. So surgery has a lot of IM questions, et cetera. And that's pretty normal in this conceptually, right? Like, because there are a lot of overlaps in different areas. Like, you are going to have to know things about IM to be able to answer questions about surgery. If you want to tailor your experience so that you are not seeing questions that you've seen before, what you can do is I'm just going to switch over to the desktop version just to show you a way to create a session around this. So if you want to create a session, if you've gone through a shelf with us, so for example, if you've gone through surgery and now you're starting to do the IM questions, you can go to questions that you've not yet answered here in this kind of general progress area, and then you can open up the questions that are specifically medicine oriented, and that should filter out anything that you've seen before with your surgery questions.
One thing that I would also add to that is there's this concern that exists that if you see the same question over and over and over again, that you're like memorizing the question and therefore not learning. Mm-hmm. And that actually is not true. It turns out that most of medicine is what you talked about before, is you're developing these caricatures of patients, which we actually call illness scripts. And so you can actually start developing your illness scripts through these questions as well. And so what I would encourage you to do actually to make the most of questions, especially when you're seeing the second time through, is that instead of just clicking the right answer, because you probably might remember and you're like, I don't know if I knew this was the right answer because I remember the question or not, is to actually then go to all the wrong answers and say why those are the wrong answers.
Yeah.
Because if you can explain to yourself why those answers are wrong and why that answer is right, that's when you're sure that the learning has actually happened. And in that process of doing the explanation, you're crystallizing it. You're synthesizing and crystallizing your understanding at the same time.
Yeah, and if you open up the library next to that question, so it'll open up to the correct answer, you can put notes into that section that the question was about why the wrong answers and the detractors were there, so that you can, if you're going through the library to review the materials, have a quick reminder to yourself about that question and why it had triggered you in that particular way. So do we have any other questions that you guys would like to know about? We can, if you want to, you can just add them here in the chat, and we can kind of pivot the rest of our discussion around those questions. And in the meantime, I'm just gonna Lisa, can you say what you mean by making so Lisa's asking here, speaking of illness scripts, is there a way to make a playlist of questions? Can you say what you mean about like a playlist? Do you mean creating a series of specific questions that you've seen before that you want to access again, or a topic area? Because I can show you one of our features in the Qbank, which is the folders that we have. And maybe I'll just start to do that. And if you want a little bit of a clarification, just add another comment in and I can pivot the answer. Okay, so we have a system for creating folders for the questions. And I think that this is a pretty common need when you're going through, there are other tools that have Qbanks where you can flag questions. But if you're going through and flagging, maybe you don't remember why you flagged them. Did I flag them because I completely guessed? Did I flag them because I didn't know it? Did I flag them because I wanted to see it again? And what we've tried to do is create a system where you can filter your questions into folders to then access them again later. So if we look at another session, this medicine session, I'm not going to go through this stem just to save on time, but maybe I wanted to revisit this question again because it was a question that I completely guessed on and had no idea. I can save those questions to a folder that is just called Guess Again, maybe. And maybe I want that to be a red folder, and I can add this question to that folder. And that way, as I'm going through and I start to go through my Qbank, I can put all of my questions that I want to see again, and then when I want to revisit them, I can go to my Create a Session, and I can go to Custom Session, and I can open up all of the questions that I had put into the Guess Again folder. So you can create as many folders and playlists as you'd like, and you can kind of tailor them to create the playlist accordingly. Heather has a question. So she's asking Tio, did you use this in addition to UWorld or instead of?
So I was, at the time that I was doing a lot of this, I was actually developing a lot of the questions that were here. And once we developed a lot of our library, actually, I've been mostly using Amboss, particularly in the ward spaces. I came onto Amboss after I had actually taken my STEP exams, and so it's not. It wasn't quite there for me to use it at this point. What I can tell you is that the people who are studying right now are sort of divided between UWorld and Amboss. And I find that a lot of the people find that doing Amboss, because it's so tailored toward the shelf exams, is a very effective way to really get your feet wet with that. And then they return to those same questions actually when they're preparing for the STEP exams. I mean, I think that the thing that's really nice about our platform that exists here is that you get to kind of have the best of both worlds. You know, one of the things that's really important when you're doing a Qbank is doing the Qbank is a way of practicing recalling the information, which is where learning happens. Mm-hmm. But if you can't recall information and you get presented information for you, you're going to then read it and then try to figure out what to do with it. The nice thing here is that it gives you a place where you can actually also write down the information so that you're not skipping through first aid CK, trying to jot something down in the margins there. And what you'll find over and over and over again, what the advice that I give people who are studying for the boards right now, is you really want to narrow down your resources to as few as possible, and really find one central place. And so the thing that I think is really cool here is that you can actually do the Qbank and then actually have the exact same place where you're linking really easily and putting your information into it. UWorld is, I think, a fantastic Qbank and allows you to do that as well. But it unfortunately doesn't have the library associated with it as well that does the linking. And I think that's one where I would often have to pull up first aid and then try to find somewhere to write down. And so that's I think one of the major strengths of this.
And I think that there's often this question, and there is a stress in choosing a new resource. And we know this. We know that you guys have been asked to try lots and lots of different tools, and whether it's different types of Qbanks or different books, where for your neurology clerkship you have to use a completely different set of resources than for surgery, than for psych. And this idea of switching every 4 weeks what tools you use, this is something that we're trying to help alleviate the pressure around. And one of the ways that I encourage people when they kind of ask me, I know UWorld works, why should I use this in addition, or why should I switch? And I usually say, one of the areas that would be a nice way to start trying to use Amboss is an area where you know you need something more. So, for example, in the surgery Qbank, you know that there are not as many questions as you might like in UWorld for the surgery Qbank. Amboss is a great place to start to utilize it as a way to get more questions around that particular topic. And you can start to kind of build them in together so that you know that you can be confident in the things that you want to use and that you know you need, and also start to try out something that might actually make your studying a bit more condensed and efficient.
Yeah, I mean, I think something to realize is that I actually think UWorld is really fantastic. A lot of my classmates used it, and a lot of my classmates are sort of debating between Amboss and UWorld here. Amboss has become a little bit more popular at Harvard now that it's actually started to launch more. One thing that I would say to understand is that UWorld is actually really geared towards the actual STEP exam, not towards the shelf exams. That's the reason why the surgery section is really low. Mm-hmm. OBGYN is actually a really low section. People usually have to supplement that with UWIS questions and also pretest questions. The surgery shelf, I think, has 150 questions because it's really geared towards really what you would see on the actual Step 2 mm-hmm. exam. The thing to note is that someone talked about medicine questions featuring heavily on the surgery shelf. Well, that's actually because when you take the surgery shelf, it's going to be very heavily medicine questions. And that's what has been really interesting about this, is that this has been designed with the idea that students are going to use this for a variety of test-taking scenarios. Mm-hmm. And so it's actually geared towards, hey, what do you actually need to know for surgery? So if you really do the surgery questions, it'll put you in a really good place. As opposed to UWorld, it's not geared towards that. So if you just do the surgery questions, you're really not going to be prepared for the surgery shelf. You really need to do additional things as well.
You're missing part of the, microphone.
Because the point of the surgery part of the UWorld is to prepare you for the surgery parts of the actual STEP exam, not for the shelf exam.
Yeah, it's a good point. So
My last thing is I would throw in is I'm preparing for internship right now, and I'm actually exclusively using Amboss as my preparation for internship. And that's actually just because the learning cards are so good that like it's actually a really great way to go back and review all of your all of the clinical presentation and diagnostic information. And the nice thing that's really cool about it is that it's really a condensed form of the management, which is really good. So I think it's one of those places where being able to go back and forth is really helpful, and having that nice toolkit is really, really great.
And it's nice that you say that, and I can't remember if I said this when we were actually filming or if we just talked about it a bit before, but the notes that you take and the experience that you have on Amboss is saved whether or not you have an active account. So we try and create a system that's as adaptable to the students using it as possible. So if you are doing your MD PhD and you take 3 years off to do your PhD, you're not using a resource, you're not paying for a resource or doing questions, anything that you did in your early years will be able to be used in your later years. And again, so in your case, you can go through and utilize your Qbank in your library to prep for your residency, which is then you can pull all this extra information that you maybe put in a bit before to be able to move forward and continue to grow your career and your medical knowledge longitudinally. We have a couple, I'm just going to wrap up because we're approaching the end of the hour, and I really appreciate your guys' patience and your questions, and we have a couple other webinars that are coming up. We're going to drop in the link into the chat so you can see what are the other topics that we're going through. We also have a code for you guys to use so that you can try out Amboss and get a little bit more time to explore. All of the content that we make is available whenever you have full access. So we talked a lot about like the surgery Qbank and the internal medicine Qbank. We don't split that up by access. So this code will give you access to the full platform, and you'll really start to explore and see kind of this crosstalk between different clinical areas. And I'm just reading the notes on the side. So if you do have any suggestions for future webinars you'd like to see, please send them an email to hello@amboss.com. We'll read them and we'll try and find a way to make a good and fun explanation for that. Lisa had one more question. And she says, can Amboss do more tutorial videos on clinical thinking and processing? Tio is great at getting me to think like a doctor. That's really sweet. Thank you for saying that. Yeah, that's a great idea. And I think that we have an amazing team. We have over 60 physicians who are working for us full time who are making this content because they really, really care about medical education and kind of passing on this system to the next generation. So definitely something we can pitch to them and see if some other people have some secret insights to go through. Thanks for that. Thanks for that comment.
Thanks.
So I think with that, we're going to wrap up. And thank you, Tio, for coming and joining me and talking about this. It's really a pleasure to
Great. Thanks for having me.
Yeah.
Take care, guys.
Okay. Bye, everyone.
Bye.
See you soon.